What are the key parameters for a correct clinical application? Since for photobiomodulation to be effective, it will be essential to adjust the therapeutic parameters based on the injury, the recovery phase, and the patient's response. These are the pillars that allow the treatment to be adapted with clinical judgment, which is what we are going to present to you next. Firstly, the power determines the strength with which we are delivering the energy, and it is always related to the therapeutic dose. Higher values will allow us to reach deeper tissues and, in turn, reduce the exposure time. It is essential to adjust the power according to the patient's tolerance and the therapeutic goal, for example, acute versus chronic or superficial versus deep. On the other hand, the energy density is what will define the effective therapeutic dose for us. It is calculated by multiplying the joules applied in relation to the square centimeters of the treated surface. Thus, for acute or superficial injuries, we tend to have lower energy densities, and when we want to treat chronic or deep pathology, we use higher doses, up to a maximum of 20 joules per square centimeter, when we want to treat chronic pathology with associated chronic pain. It is important to make a good calculation of the dose to avoid underdosing or overdosing. Therefore, it is also recommended to use the calculation tool provided by the software itself to calculate the dose and thus ensure correct dosing. The time will depend directly on the dose and the selected power. The higher the power, the less time is needed to apply the same dose. This allows us to optimize the performance of the session, especially when treating large areas or multiple areas in the same session. In terms of contact mode, we can differentiate between with contact or without contact, as direct contact will improve the penetration of the light, reduce dispersion, and allow for slight compression of the tissue, thus increasing effectiveness by more than 15%. When we are without contact, it will be more useful in sensitive areas, open areas, or with bony prominences. However, it requires adjusting the power and distance to avoid energy loss. As a key message, an effective treatment requires more than just turning on the laser. It needs clinical judgment in the selection of parameters, combining high power, direct contact, and the appropriate dose, according to phase and tissue, is what will allow us to achieve the documented therapeutic benefits.